It's time now for Ask the Surgeon, brought to you by Everett Bone and Joint. Everett Bone and Joint, the best choice to get you back in the game. Learn more at everettboneandjoint.com.
All right, that music means one thing. It's time to ask the surgeon. And I got to tell you, we've asked a lot of surgeons, and I've never had a surgeon to ask that I could actually vouch for. My guy, Dr. Bill Huang, is with us today.
Hey,
how
Mark.
are you?
How are you doing?
I'm fantastic, thanks. Very good. How are you?
Pretty good.
Good.
So, Bill, let's see. So you actually are intimate with Maury's knee then?
Yes. Yes.
Okay. So, before we get into the questions regarding total joints and kind of the latest and greatest in knee replacements, give us a little background. How'd you get to where you're at? I understand you have a fellowship in joint replacement, so let's talk about that.
Yes. So in order to be board certified for orthopedic surgery in the States, we have to complete a orthopedic residency program. That's typically 5 or 6 years after medical school. And because I fell in love with joint replacement during my residency training, I took an additional year to do a specialized training and just focusing on hip and knee replacement. And I did that in Washington, D.C., and I came out here after the training. So just a lot of schooling, but it's worth it. So
you put some time in to your education. So essentially, during that 5 years of residency, you're exposed to all kinds of orthopedic problems. And then during that time, you said, "I want to do total joints," and you do an extra year, and that's the fellowship. And is that all you do? Is that your caseload now? Pretty much total joints.
Pretty much. Now, most of my practice is hip and knee replacement, and this is one of those procedures that the more you do, the better you at it, and the more variation you see, the more you're capable of taking care of the problem if you ever to see them.
So how many do you do a year, say?
Oh, boy.
Well, how many did you do today? No.
Today I'm actually off. So.
Okay, hey, coming in on your day off.
So isn't it
Yes.
Tuesdays?
That's
Isn't
great,
it Tuesdays when the magic happens?
Yes. Typically, I would say we're probably doing about 350 to 375 joint replacement a year. So
here's the deal. This technique has come a long ways. I mean, the research advancement that has occurred over the last 20 years, because they've been doing these for about 20, 25 years now.
Hip and knee replacement probably since the late 60s.
Okay, so
that's amazing.
Yeah, and in today's world, you're doing these. Give us some reasons why you'd have a total joint replacement or a what they call unicompartmental joint. Let's talk about the two things that you can have done.
Great. Well, why anybody would need a joint replacement? This is probably one of the most successful surgery in the 20th century. Before joint replacement came about, when you wear out your joint, you got two options. You either live with it or somebody will fuse your joint together.
Okay.
So when you fuse it, that means you can't bend it at all. So in the late 60s, people start coming up with the technology. Let's say replace the artificial parts in the cartilage that's worn out. So that's now the number in the United States, we're looking at probably over 600 joint replacement that will be done in the States. And
wow. Well,
here's what I've noticed since I had total knee replacement. A lot of people have had total knee replacement.
Yeah.
Yeah, I mean, I just kind of mention it and be, oh, yeah, I had that done. So.
Well, again, with the aging population and people wanting to stay more functional, I mean, what do they say? The new 70 is the yesterday's 50 or something like that?
Something like that.
Something like that. We definitely see a lot more younger patient for joint replacement. People are staying more active. They want to stay more active, want to do more stuff, and just simply tell somebody who have bad joints that, well, just sit down and wait until you're 75. It's harder and harder to do. And fortunately, our technology has kept up. We have better materials. We have better implants that they hopefully will last longer. And our surgical technique has gotten better. And with respect to the question you asked earlier about the partial or unicompartmental knee replacement, that's a good option for some of the patients who perhaps only have arthritis or cartilage problem in part of the joint. So instead of replacing the whole thing, you just replace part of it. And hopefully that will be like a bridging procedure, save some more tissue just in case in the future, if the joint replacement were to go bad, you can convert that to a full joint replacement.
Okay, so just so people can kind of get a concept of this, you're not replacing the total joint, you're replacing just part of it, and it's usually the part that's worn out.
Exactly.
So you're putting basically half a joint in there, essentially.
We can either put in the knee replacement. We see in the knee as the three parts. There's inside, the outside, and underneath the kneecap.
Right.
And a true partial knee replacement, you just replace either the inside or the outside. But we also have the technology to replace 2 out of 3, or 3 out of 3. That will be a full knee replacement.
Okay, so and when you say 3 out of 3, that's the total joint.
The total joint replacement.
And so when you go in and are based on X-rays and MRIs, and how do you decide to do a unicompartmental or the total joint?
Take me for instance.
Yeah, here, let's use more.
Because I was going to be a partial, right?
Yeah, you're going to.
Yeah.
So in order for partial knee replacement to work, you gotta only have cartilage problem or arthritis in part of the knee. In Maury's case, that based on the X-ray and the MRI, we knew he had a lot of problem in the inside part of his knee joint. But at the same time, the X-ray or the MRI also is suggestive that there are problem in the other part of the knee. Until we open his knee up and take a look at the inside, it's really hard to tell for sure exactly how much problem he has in the other portion. Unfortunately, Moore's case, when we opened up his knee joint, in addition to the inside part that was completely worn out and diseased, rest of the knee joint is also pretty beat up. And as a result, we end up doing a full knee replacement for Moore instead of partial.
So that was a decision based on once you visually got in there and saw what you were working with.
That's right.
Now, didn't you have avascular necrosis?
I did, yeah.
So let's talk about avascular necrosis and osteoarthritis and the difference there.
Sure. Avascular necrosis, also known as osteonecrosis, is basically for whatever reason, the blood supply to the bone underneath the cartilage went away. So in your particular case, we don't really exactly know what caused that in the first place, and it's much more common in the hip than the knees, but we certainly see a good portion in the knee joint. And when the blood supply to the bone disappear, the bone actually dies. That's the term necrosis came in. And once you don't have the support underneath the cartilage, and the cartilage will simply collapse, kind of like an eggshell when you don't have the support underneath the cartilage.
Okay. Mm-hmm. Okay. So you had no choice then. So yeah, Maury was going in as a partial possibly, and then a total. What's the rehab time and outcomes for those two? Let's talk about the unicompartmental or partial knee.
Partial knee replacement, I would say the rehab is probably 2/3 as tough as a full knee replacement. And typically we do a lot less. In the partial knee, we cut a lot less tissue and a lot less bone, and the recovery is a little bit faster than the full knee replacement. Maury can probably attest to the recovery from full knee replacement in terms of the pain and discomfort and how long it gets over. But in general, I tell patients within first 30 days of a knee replacement, a full knee replacement, most people are about 70% recover, i.e. they're walking pretty good, they're still a little sore and swollen, and they don't have the full strength and perhaps not all the motion. And in the next few months, that's when they're going to get the strength and endurance and swelling down.
And so that's with both of them then, both either the partial and the full. They're both.
I would say the partial actually within 30 days, most people are probably at 85% recover.
Okay. So if I'm a there's a lot of these mid 50-year-old people out there in the world right now that have these worn out joints. And they're not worn out enough for a total joint, but this partial sounds like it's a great option for people.
Partial is a great option. Unfortunately, most of the time when we go in there are a lot more wear than one has to accept. And if you leave the bad joint behind and just simply do a partial, there's a higher propensity for the other part of the knee to go bad and perhaps requiring additional surgery sooner.
What about I've talked to people that this one client of mine that I met with, her dad had 2 full knee replacements done at the same time.
That certainly is done in our community.
It doesn't sound like a fun thing to me.
Yeah,
No,
yeah, that doesn't sound like a good outcome.
It is extremely tough to recover from bilateral knee replacement. As you can attest just from one, it's fairly painful initially in the first few weeks. Certain time we will do a complete replacement on both sides, but unfortunately it is tough to recover from, and it is associated with slightly higher complication rate as well.
So here, let me just ask one question, and I noticed, we have questions here that we ask, and even though I was there for this, what actually happens during total knee replacement?
So during our surgery with you, more after you get your anesthetic,
because can I interrupt you for 1 second? Because I've had like meniscus type things, and I've been awake for these things, and I asked the nurse. As they were kind of hooking me up and stuff, hey, am I going to be awake for this? And she says, you don't want to be awake for this. And I said, what? And then I was out cold. So so talk to me here.
Yeah, okay.
Yeah.
Well, the reason why we typically don't have patients stay that awake is when we do knee replacement, we actually have to use a saw and hammer to really actually make a lot of bony work. So a lot of the sound and sometimes the smell of the tissue from the surgery sometimes gets to people. So generally, when you have to do more extensive surgery, we usually have people be a lot more sedated, even though you only have a spinal anesthetic in which only your lower body was fully anesthetized.
Well, and plus, I mean, that's a lot of work. How long is that surgery, a total joint? How long would Maury have been in the OR?
The surgery time for Maury is actually only about an hour and a half.
Well, okay.
The actual surgery time is about an hour and a half.
He can do it with his eyes closed.
Yeah, well, he's got a fellowship.
Yeah, I know. He's got a fellowship.
But, I mean, what people need to realize, when you're a total joint, you're cutting off the end of the femur and you're cutting off the end of your tibia, right?
Yeah.
And you're replacing those with these parts going in there.
We use some heavy duty, hardware. I mean, we use saw that makes a lot of noise, and sometimes, we use a lot. There's a lot of stuff that goes on, and I think if you're fully awake, realize that your leg's being cut off.
I have to admit to something. So in my month that I was at home, just going crazy on pain meds, I YouTubed total knee replacement.
Oh, you saw one on YouTube?
Oh, I almost fell out of my chair. I couldn't believe that. So yeah, I understand what you're saying.
So a guy like Maury with the total joint. Now you like to golf, right?
I do.
I mean, he's gonna be able to get back to golf.
Yes.
And he could probably elliptical trainer at the gym. Probably not. What about running? What about if he wanted to run? I mean, how do you feel about that?
I am certainly not an advocate for people who like to do repetitive sort of pounding activity, such as running and jumping. But there's certainly people who have artificial joints that does that.
Well, he could snow ski.
Yes.
I mean, but
I don't snow ski.
Yeah, no, I know you don't.
I wouldn't snow ski.
I know you don't. But if you wanted to snow ski with a total joint, you possibly could do that. Now, are you with a younger population? You're waiting for bony growth into the. Or are you gluing these things in?
Most of the knee replacement done in the United States are glued in. So the knee attachment to your bone is as strong as it is immediately after surgery.
So you've got some you're glued.
It's good to know.
You're glued.
It's good to know. And then my big question was, am I going to beep going through airports?
Yes.
And I am going to be.
You got a card, though, don't you?
No, they don't do cards anymore.
We used to give out joint replacement cards to patients before 9/11.
Right.
But now if you set up the alarm system, you're just going to get pulled to the side and you show them the card. They're still going to put a metal wand around you.
Yeah.
So we stopped giving out the cards because they seems to now.
It's not effective.
It doesn't do anything anymore.
I'm looking forward to that.
So if how long are these is there enough research like these unicompartment knee replacements that you're doing? How long are they lasting?
Well, it's based on statistical study. I would say what I tell patients is if you have a partial knee replacement, at 10 years after surgery, there's probably 85% chance that the knee is doing well and you don't need to have any additional surgery. And with a full knee replacement at 10 years, there's probably a 90% chance that the knee is doing well and 10% chance that you need to have additional surgery. And obviously, as the time goes on, by 20 years, there's going to be higher failure rate at 20 years after surgery.
So you're good for at least 15.
Yeah. So when I'm around 70.
Kick the tires at 15.
And by then, technology is like going to the dentist. That's going to be like.
Yeah, exactly.
Yeah.
So if you do have a unicompartmental knee, and let's say you're in your mid-40s and you just have that worn-out knee that you have so much pain and you're just in a lot of discomfort, you can't really do the activities that you'd like to do, and you have that unicompartmental knee, chances are you're going to have that thing, a total joint down the road.
Possibly, but not always. There's certainly enough data that shows that if you pick the patient right, that the partial knee can last a good long time.
Okay.
That's it.
Wow.
That's the time.
That's great information.
Always a pleasure to
thank you, Maury.
talk to you. Thank you very much. Thanks for everything, by the way.
Bill, thank you. It's always nice having Maury on board because, I mean, you've got this example over here we can talk.
And I had my knee replaced for the show, too, I might
Exactly.
add.
You did it for the team. Thank you. 1 year anniversary.
Exactly. Dr. Bill Huang, Everett Bone and Joint. For more information on him,